lesson I'd like to teach a new surgeon is to be sure that you really, really listen to the patient and make sure that you know what their deep concerns are. But you have to listen with your heart, and because sometimes it's not always in the words they say. And when someone now comes to me today for a breast augmentation consultation, most people have already gone online, and they're very, very well educated. Stunning. You know, it used to be that someone would come in and say, "Tell me about getting a boob job," and now it's a completely different playing field. So people are incredibly well educated. As a woman, I find that women come to me for breast surgery and aesthetic concerns. I can relate maybe a little better. I've maybe had a few surgeries myself, so I can tell them what it's like from the patient's viewpoint as well.
One reason I'm considering plastic surgery is because I really want to look as young as I feel. I still feel like I'm in my 30s and I'm in my early 40s, and I want to look like I did in my 30s.
I think the most common thing people come in with is the idea that my girlfriend had this size and that's the size that I want, but it doesn't relate at all. You can't borrow your friend's breast, or you are not going to look the same with that size that she will look.
One concern I have about a breast lift is scarring and how quickly the scars will fade and eventually look over time.
What's your recovery going to be like? The difference between how you look in clothes and how you look in a bathing suit. Will the people at church be able to see that you've had surgery? Things like that. People are very concerned about. So the time in a consultation not only goes over some of the technical details they've already learned, but we apply that to them personally. What is this going to mean in their life? Thank you for taking the time to listen. We invite you now to call and schedule an appointment.